If you are considering Juvéderm Voluma XC and you live in the Virginia Beach, Norfolk, or Southampton Roads area, you will want to listen to our guest. Today we have with us Dr. David McDaniel, who serves on the Medical Advisory Board for Juvéderm Voluma. Dr. McDaniel, please tell us exactly what Juvéderm Voluma is and how it is different from other fillers.
Well, Amy, Juvéderm Voluma XC is a very exciting new product. It's the next generation of the Juvéderm type fillers, which have been around for years. So Juvéderm Voluma has been in Europe since about 2005. It's been used in many countries. It's been very, very successful. It's the first FDA-approved product that's non-surgical, that provides instant lifting of your mid-cheek or your central cheek and mid-face area. So when you inject Voluma, Juvéderm Voluma, you can see an instant volumization. You restore lost volume, and you also get some lifting of the face. So that's probably one of the more dramatic issues with Voluma. Now, another thing that's really important about Voluma is that it lasts up to 2 years. So it basically gives an instant lift. It helps restore age-related mid-cheek or central face volume loss, and it lasts a long time. It's a very safe product. It's created from sugars that occur in our body naturally, so it has a great safety record as well.
Tell us about the problems typically corrected with Juvéderm Voluma.
Well, that's a good question. Juvéderm Voluma was really designed specifically to help with age-related volume loss. So as we age, we lose volume in our face, and you can think of those, the fat pads, those little airbags, as they deflate and we lose volume, age-related fat volume loss. The fabric of our skins redrapes, and most of us don't like the way it redrapes. So depending on your skin elasticity and gravity, some of us have flattening of our cheeks and we get some jowling and overhang of furs here. Other people get more loss of their neckline. So whether you've flattened your cheeks, you've got hollowness, you've got overhanging and furs here, or you have jowling and turkey neck, most of us don't think that's a terribly youthful look. So Voluma, for a younger person, a little bit of Voluma in a younger person with very early skin laxity truly gives a quasi facelift like effect. It isn't a facelift, but it gives a lift and it restores the high cheek apex where you put your blush. For men, it helps give a little bit more masculine rested look. So for younger people, a little bit of Voluma goes a long way. Some of our more dramatic results have been with younger people. As you age and you lose collagen, you lose elasticity, you lose a good bit more fat volume, there's more sagging and laxity. If you use more Voluma, you can still restore the volume. You may have sun damage and wrinkles and lines and things like that. So on our older patients that have multiple problems, we'll use Voluma as one piece of a total facial rejuvenation. That is, if you have lines and creases from frowning or scowling, or you're just an animated person, we might use some Botox to relax the lines. We would use the Voluma, the Juvéderm Voluma, to help restore lost volume in your cheeks. We can actually get some lifting here. There are a number of very creative things you can do with Juvéderm Voluma off-label. These have been pioneered in Europe and Canada and other countries. They're very well established. So we use both the on-label and off-label techniques so that we can have the artistry. They're little micro cannulas that are very small, that don't have a point on the end of the needle. So we can make a small pilot hole. We can then treat large areas with very minimal bruising or discomfort. So we can re-sculpt as well as lift and volumize. If you have sun weathering and you didn't used to use sunscreen, or you smoked and you have fine lines, we can add things like fractional laser resurfacing, IPLs. If you want to improve your eyes, sometimes we can get a little lift with filler or with Botox. So Voluma is one of the missing pieces of being able to do total or complete facial rejuvenation non-surgically, something that we've wanted as cosmetic surgeons for years. If you want, you can even make your eyelashes look longer with Latisse. So we have skincare products at home that help even out your skin tone, stimulate collagen. We have eyelash lengtheners, wrinkle fillers. We have volumizers. So we have a wide array of options now, but the missing piece was the ability to restore volume. Age-related volume loss is one of the main signs of early aging, other than wrinkles and sun damage, and it's also one of the critical features. So even for people who get facelifts, typically people who get facelifts also will get fat grafting or they'll get a filler. You have to restore the volume to have a truly natural looking youthful face. So, Amy, we all know people who had a facelift and they look like they've been pulled too tight. Those are the people that their skin was tightened, but they did not restore volume.
What ages can be treated, and what kind of results do you expect?
Well, I think, Amy, you can treat from 21 up to pretty much any age, and we've treated people into their 80s. As I mentioned earlier, younger people really, they don't need much voluma, but it's critical that you put it in the right areas. As your cheek flattens and women lose the pretty S curve called an OG, this S that gives you the high cheekbones and the pretty youthful look. A little bit of voluma right here will pull up, and it does not take much. So younger people, a little bit of voluma or a little bit of voluma and perhaps some Botox can really deal with not only your early sagging and laxity, but also your fine lines and frown lines and crow's feet. As people age, they need more components, so they may need volume correction, but they also may need some laser resurfacing. So it really isn't so much an age limit as it is trying to choose the different pieces of non-surgical treatment to make a complete treatment program so that everything looks synchronized, it looks natural. One of the big features of Voluma is people look natural. When it's done properly, they have a soft, rested, youthful look. And the studies that were done originally for the FDA, patients in those studies said they felt like they were an average of 2 to 5 years younger. Some of the people we treat with a small amount of Voluma on a low budget, they look rested, relaxed, refreshed. Some of the other people that we use a little bit more material, they truly look lifted and they look 5 years younger.
How long does it last?
Juvéderm Voluma lasts up to 2 years. When you optimally correct, it can last anywhere from maybe 18 months to probably there are people, based on what I've heard from my European colleagues, that it can last longer. With the prior forms of Juvéderm and other materials like Juvéderm, such as Restylane, there is scientific data that shows that it actually stimulates your body to make its own collagen. So I think we'll see some of that also with Voluma, but up to 2 years is a good average, depending on each person is a little bit different.
Are treatments painful?
That's a good question. All these treatments, even the non-surgical ones, have some discomfort. Voluma is really interesting. Juvéderm Voluma, because of the needles and the technique used, and particularly if you use the blunt cannulas that are needles without a tip, it's probably less uncomfortable than most of the fillers and injectables we've used in our career. The cheek areas aren't that sensitive, and you're actually going down right on top of the bone, and you're actually putting the Juvéderm Voluma in, and the Voluma acts like little tent poles. So if you can imagine your cheekbone being the ground, the Voluma acts like a tent pole, and it fills up, and just like you'd put a tent up, it lifts up the canvas, which is your skin, and it restores the contour and shape. So if you've ever seen a tent that was partially deflated and you straighten all the tent poles and everything looks pretty again, that's a little bit like what we do. So that area is not very prone to bruising. It's not a particularly painful area. So a little bit of numbing cream or some ice cubes, and it's really quite tolerable. Most patients are surprised. If you have fine lines around the mouth, and we're using some of the other forms like Juvéderm Ultra, which is designed for that, then that's a more sensitive area. So, but generally the Voluma itself is relatively minimal discomfort. There's a little bit of bruising and swelling. There aren't too many problems with it. So all of these non-surgical things, whether they're fractional lasers, IPL, Botox, Juvéderm Ultra, or the new Juvéderm Voluma, they're all can be done with just numbing cream or numbing cream and ice packs. Other than the bruising and a little swelling, there's very little downtime. A lot of people can put on makeup immediately and return to work. It's a little bit harder for men because you can't camouflage things with makeup, but we do have lasers that will help make bruising fade faster. In our program, we use those, and they've been quite successful as well.
Can all skin types be treated?
Yes, that's another good question. There really aren't any contraindications for Voluma as far as skin types. So skin of all colors can be treated: Hispanic, Asian, African American, European. The artistry is different because you have different features depending on your cheekbones and your ethnic ancestry, and cultural issues can be a factor. So we will customize it based on that. And you didn't ask about men and women, but men and women can be treated. Men have a different cheekbone structure as far as how their fat's distributed. So if we make men with very high cheekbones, they may not like it. If we make women have masculine-looking cheek and jaw, they might not be too thrilled about that as well. So there's a technical component, and then there's an artistic component, and when those come together properly, then men and women of all ages, really adults upward, and all ethnicities can be treated successfully.
If you've received a filler in the past, can you still be treated?
That's another good question, Amy. Yes. No matter what filler you've had in the past, you're potentially a candidate for Juvéderm Voluma. It's an interesting question, though, because some people who have been treated in the past will be treated differently. That is, if you had Juvéderm, let's say Ultra Plus, put in lines and furrows here, and you've had that done in the past, and you liked the results, but it wasn't as good as you'd like. When you put Voluma in here, when you put Juvéderm Voluma in, it usually lifts this area. When it lifts, this area will not be as deep. So there is a big difference in those. Many of the people that get treated with Voluma need less of the fillers that they had been treated with in the past, and often they don't need anything at all. So you're really not just adding Voluma to your current filler regimen, you're actually using Voluma and then looking to see what, if anything, still needs to be corrected. So now Voluma can't be used for fine lines, so let's say you had deep folds and marionette lines here, and you were looking tired and sad and you've been happy with your filler, but you'd like to have more. When you put Voluma in, you may not need to have anything put in those lines, or often you'll need much less. But let's say you had some little fine barcode smoker's lines, those will have to still be treated. So we often treat people differently, and in fact I do the Voluma first because it changes the face so much that often you really don't use your old treatment regimen. So if you keep in mind that it lasts about 2 years, so it lasts almost twice as long as most of the other fillers, doesn't cost twice as much, so that's about a wash, but you may not need some of the other fillers. It actually is a fairly different process for some people. For a younger person that's never had a filler, they may get Voluma and not ever be treated here, so they won't know what I'm talking about, but for those people listening to this who've had fillers in the past, you really need an individualized consultation with someone who's an expert in the Voluma, because it does really change the way we do things.